Radiofrequency ablation of benign thyroid nodules using antilateral hydrodissection and an adjustable electrode. Radiofrequency ablation of the thyroid is a minimally invasive procedure that uses a radiofrequency electrode under ultrasonic guidance to ablate nodules with thermal energy by selectively ablating only the tumor tissue. The procedure preserves thyroid function and allows for a quick return to daily activities. However, during the procedure, the heat generated by the electrode may radiate beyond the tumor, causing pain for the patient. This can make the treatment more challenging. If the margin of the tumor is not fully treated due to patient discomfort, the untreated portion may remain and potentially regrow. Therefore, it is crucial to minimize patient pain while achieving complete ablation of the tumor. In thyroid procedures, careful consideration must be given to surrounding structures such as the strap muscles, blood vessels, nerves, and trachea. Using an adjustable electrode and anterolateral hydrodissection during RFA enables a more effective and precise treatment. ALHD is a technique used during thyroid radiofrequency ablation where fluid is injected between the thyroid gland and surrounding muscles to create space, reduce pain, and minimize the risk of nerve injury. In this procedure, the electrode tip is extended to 10 to 15 millimeters to quickly ablate the wider central portions of the nodule, while areas near critical or pain-sensitive structures are treated more precisely by simultaneously performing ALHD and shortening the tip to 5 to 7.5 millimeters. Injecting fluid between the strap muscles helps minimize patient discomfort during the procedure. It also protects nearby nerves and blood vessels, providing a safer environment for stable ablation along the tumor margin. By combining the adjustable electrode with ALHD, the tumor margin can be treated safely and effectively while minimizing pain. We would also like to introduce a relevant research article. This paper provides detailed insights into the application and benefits of ALHD. The electrode can be adjusted in 5 steps from 5 mm to 15 mm, enabling fast and extensive ablation as well as safe and precise treatment. We will now begin the RFA procedure using anterolateral hydrodissection and an adjustable electrode. Local anesthesia is administered by inserting a needle at the midline of the anterior neck, just above the thyroid isthmus, and injecting an anesthetic up to the thyroid capsule. Then, the 5% dextrose water is injected around the thyroid, including the strap muscles and thyroid capsule. The electrode length is adjusted to 5 to 7 mm depending on the size of the isthmus. Using Doppler ultrasound, the blood vessels in the isthmus are identified and the electrode is inserted using the transisthmic approach. Ablating the blood vessels in the thyroid isthmus first helps reduce blood supply to the tumor and minimizes the heat sink effect, allowing for more stable treatment. Areas close to the trachea must be treated quickly, as heat conduction to the trachea can cause coughing and may require the procedure to stop immediately. After adjusting the electrode length to 10 to 15 millimeters, the central portion of the tumor is ablated. The tumor margin is then ablated using the moving shot technique, leaving a 3 to 5 millimeter buffer. To ablate the tumor margin, 5% dextrose water is injected through the same injection needle. creating at least a 10mm separation between the tumor and critical structures, such as the strap muscles, blood vessels, and nerves. Finally, the ablating of the tumor margin and surrounding blood vessels is performed. The electrode is adjusted to 5 to 7.5 millimeters. And, under Doppler guidance, the blood flow near the tumor margin is carefully monitored to enable precise ablation. For tumors located near the trachea or recurrent laryngeal nerve, a small portion may be intentionally left untreated. If voice change occurs during RFA, cold 5% dextrose water is rapidly injected through the anesthesia needle. Once the procedure is complete, the thyroid nodule is completely ablated. Summary of the anterolateral hydrodissection procedure. Radiofrequency ablation of benign nodules using anterolateral hydrodissection and an adjustable electrode creates separation between the tumor and surrounding structures such as the strap muscles and other critical tissues, effectively minimizing patient pain and procedure risk. The electrode tip is adjusted to 10 to 15 millimeters to allow for rapid and extensive ablation of the tumor's central portion. Because the tumor is completely ablated, this approach is highly effective in preventing recurrence.